Uh, Name is Sam Samoff. I'm 74 years old.
My name is Arthur Newby. I'm 88 at the moment, and I have heart failure.
Well, I'm Graham Deacon. I'm 69, and in 1999 I had a heart attack.
It's the breathlessness, and then more recently, what's gotten me is this feeling of, I don't know, just no energy, no, I can't really seem to get going,
You do get sort of swellings of some of the, like your ankles, and you can get a feeling of tiredness. It's a big changing point in your life. Makes you look at things entirely differently, and just makes you glad for, the extra time you've now got.
I feel like I'm now living on borrowed time, and it's difficult to cope with. Try and be happy and try and keep going for your family, but at times it can be very difficult. I'd just like to know, but nobody can tell me whether I'll see my next birthday, my family's birthdays, Easter, next Christmas. My son jokingly said, we won't buy any Christmas presents then in advance. I thought, that's nice of you. Anyway, that'll save money for him.
Causing the breathlessness because of the buildup of fluid on the lungs. So they started pumping me full of diuretics. Because with the diuretics, when they hit, they hit. And so, as I say, you quickly learn where every toilet in Liverpool is located. I guess that's one of the side advantages of it. The problem is my breathlessness, despite all this, is quite bad. And I've been diagnosed with chronic kidney failure, stage 3. So this is the problem. I need the diuretics to try to clear the fluid so I can breathe. But on the other hand, they're walloping the kidneys. The dialysis will require a complete changing of the priorities of my life. And that's not something I'm good at, nor something I'm looking forward to. I don't have any choice. The options are just to leave it as it is, and the situation continues to deteriorate. And not only that, if the situation deteriorates and they do have to put me on peritoneal dialysis, the risk will be even greater, you see. I sort of owe it to the people that, that I work with, I associate with, that I say I like to keep going as long as I can, as much as I can.
The reason for designing the project was that in my clinical practice, I saw a lot of patients coming in with renal failure induced by diuretics. And this is in fact the second commonest adverse drug reaction which leads to admission to our hospitals.
There's over 900,000 people in the UK with heart failure, and about 1 in 20 of them get acute kidney injury, and they have to go to hospital for reasons that are completely preventable because of their diuretics. If we don't do anything about it, these admissions and these deaths will continue to increase. I've been on the front line of NHS services, and I've seen these patients come in. I've seen them in front of me. I've struggled with dealing with them and trying to get them back to their normal state, but it's so difficult when you have all of these complications that could have been prevented in the first place. I think that this guidance is needed in order to save these patients' lives and to make the treatment of this difficult condition a lot easier. I truly believe that this kind of work is the first step towards a much safer prescribing environment in the NHS. And so it's my goal to try and push through this new way of generating guidelines using patients' data to effectively reduce the number of admissions and reduce the number of deaths that should have been prevented in the first place. And I hope that this project will give people, GPs and other doctors, the tools that they need to make treating heart failure much safer and prevent all of those lost lives.